Welcome to the module on telehealth, home health, and public health. Technology tools and information systems are changing how clinicians deliver care at a distance. Telehealth could be considered a subset of e-health because the overall concept is to provide long-distance clinical health care. Some types of telemedicine have been used for many years. One of the best examples is the nurse call line that some insurance companies have initiated. Ever since radiology went from films to digital format, it has been common to have emergency departments send radiology files to a remote radiologist to be read and reported on during the nights and weekends. Telehealth technologies include telephones, fax machines, email systems, video conferencing, remote patient monitoring devices, and conference calls. The benefits for telehealth have always been there. There is more immediate access to care, more independence for the client, decreased travel time, more access to specialists, and patient satisfaction. The drawbacks for telehealth have been cross-state licensure, physician privileging in multiple states, lack of acceptance by insurance companies, poor internet service in some areas, poor telehealth equipment, funding and reimbursement, liability, and malpractice. However, new advancements in biometric sensors and monitoring devices, new technology, and interoperability for telecommunications have increased clients with multiple chronic conditions have opened the door for a new look at telehealth options, especially in conjunction with home health. Video conferencing, along with digital monitoring devices that transmit vital signs, can be used for clinic e-visits as well as home health visits. Information systems for home health were not supported by the HITECH Act, which funded systems for hospitals and providers. Many agencies have lagged behind in adopting a computerized information system. In addition, vendors have not fully developed the more advanced functions of an EHR for smaller systems. The Omaha system is a fully developed nursing terminology that supports the problem, intervention, and outcome rating scheme for home health services. In addition, new reimbursement models such as value-based purchasing and penalties for readmissions are more supportive of keeping clients at home. Thus, both the technology and the payment models are contributing to the uptake for home health and telehealth. A final topic for this module is public health information systems. Public health information systems are limited because the national government is limited on its authority in matters of public health. Most public health authority and activity is largely a county function. This creates a series of problems with data standardization, data ownership, and lack of willingness to share data across states and with the federal government. Some information systems, such as the National Notifiable Disease Surveillance System, have been successful because the states and counties have understood the need to track infectious disease. Surveillance of non-infectious disease is usually managed by state health agencies because the interventions are often done statewide. The CDC and other federal agencies monitor national trends and conduct national surveys such as the National Health and Nutrition Examination Survey, the Annual Survey of Work-Related Injuries and Illnesses. The best example of a public health informatics application is the Immunization Information System that records all immunization doses administered by participating healthcare providers. This is an important tool in achieving and maintaining effective vaccination coverage levels. This system represents the successful blending of multiple data and messaging standards and multiple governing agencies.